In this video, we're going to take a look at a few different examples of posterior cruciate ligament injuries. So here we have three different cases. We can see that in all three cases, the posterior cruciate ligament looks abnormal. Now, the injury pattern largely depends on your patient population, but intrasubstance tears are particularly common. This is where the tear involves generally the central portion of the ligament rather than being avulsed from either the proximal or distal attachments. The posterior cruciate is different from the anterior cruciate in a number of morphological aspects. It is also composed of two main fibre bundles like the anterior cruciate, but the two bundles are much more tightly compact and contained within a tighter sheath. And that's why the PCL tends to look better defined than the anterior cruciate and looks more dark or low signal on MRI. And the morphology also affects its appearance when it is injured, because often, even though there's a complete tear of the fibre bundles, much of the hemorrhage and edema remains contained within the sheath. So it's not surprising when, even with a high-grade tear, the overall shape of the posterior cruciate is preserved. And that's the case really in these two injuries. In this patient, it's a little different. The posterior cruciate in this case has been avulsed from its tibial attachment. The overall signal of the posterior cruciate appears to be better preserved. Of course, that also depends on how acute the injury is. But you can see that this is a different tear pattern from the other two cases. And if we look at the coronal image in this patient, we can see that the ligament has been avulsed from the tibial attachment. It is displaced proximally, and in this case is restrained by the meniscofemoral ligament. So this is the meniscofemoral ligament here, running from close to the posterior root of the lateral meniscus up towards the femoral condyle. There are often two components, one anterior and one posterior to the posterior cruciate ligament. And in this case, the meniscofemoral ligament stays fairly taut and appears to constrain the proximal migration of the torn PCL. There are two common causes of PCL injury. One is a direct impact injury to the anterior tibia, where the tibia is forced posteriorly, extending and then tearing the posterior cruciate. The second is where you have a hyperextension injury, where there is an abnormal hyperextension, forward movement of the tibia, which tears the PCL. And often you can tell which injury has caused the PCL rupture, either from the patient's clinical history or from the pattern of microfracture. So initially you might suspect that this is a direct impact injury to the anterior tibia in view of the fact that you actually have quite a significant compression fracture of the anterior tibial margin. But if we scan a little bit further, we can see that there's also a compression fracture of the lateral femoral condyle, almost the same pattern as a pivot shift injury. And here it's easy to appreciate how these two bone surfaces have compressed together and that this is a hyperextension injury. When you have hyperextension injuries, it's also important to appreciate that you can get other tears of the posterior capsule. And you can see here that there's quite a lot of hemorrhage in the popliteal fossa in both of these patients. And that would certainly be consistent with an associated tear of the posterior capsule. In this patient, there is an example of another associated injury, which is important to look for because it's easy to overlook. If we just turn to the coronal image in this patient first and look at the posterolateral corner, we can see that the popliteus tendon attaches here within the popliteus fossa. So this is a nice normal popliteus attachment. In this patient, which is the other side, if we look for the same popliteus attachment, we see that in fact we have an empty fossa here, and there are fragments of the avulsed popliteus tendon extending down here. So this is a not uncommon association with posterior cruciate ligament injuries, and it's important to look for because it's an easy injury to overlook. So we just have examples of different types of posterior cruciate ligament injury associated with some different mechanisms, and we've discussed the important associated injuries to look for, including popliteus injuries and injuries to the posterior capsule. Of course, because it takes quite a high force to rupture the posterior cruciate ligament, it's not uncommon that we see associated other injuries, including this longitudinal. In fact, it's a double longitudinal tear of the posterior third of the lateral meniscus, and also a complex tear with both horizontal and longitudinal elements of the posterior third of the medial meniscus.